Smoking is the single biggest modifiable health risk during pregnancy. It can cause premature birth, miscarriage, stillbirth, low birth weight, neonatal death, and sudden infant death. While nicotine is the addictive element of tobacco, it is the thousands of other chemicals in the smoke that cause almost all of the harm. This means that exposure to secondhand smoke is also dangerous. When a pregnant woman smokes or breathes in other people's smoke, she is inhaling carbon monoxide and many other harmful chemicals. These enter the bloodstream through her lungs and are then passed on to the baby through the placenta and umbilical cord. The poisons have multiple damaging effects, including restricting the flow of healthy, oxygenated blood and nutrients to the baby. They can also affect the child's intellectual development and stunt their growth. The only way to remove the risk is to stop smoking completely. All pregnant women should be routinely screened for carbon monoxide. Carbon monoxide depletes the bloodstream of oxygen and is particularly harmful to a developing fetus. A reading of 4 parts per million or above should trigger further action, because it may mean the woman is a smoker or has been exposed to secondhand smoke. Or it may mean she has inhaled carbon monoxide from another source, such as a faulty boiler. Carbon monoxide screening is an effective way to introduce the topic of smoking in a non-judgmental way. Midwives and other healthcare professionals can then talk to women about smoking and the importance of quitting. This can be done in 3 steps. Ask. Ask and record if she is currently a smoker or has recently quit. Advise. Explain that her raised carbon monoxide level is a cause for concern and that stopping smoking is the best thing she can do for her own and her baby's health. Act. Refer her to someone who can provide specialist treatment to help her quit. If you do not have a carbon monoxide monitor, you can still use these steps to ask a woman about her smoking and advise her on how to stop. There is support available to help pregnant women quit smoking. You should find out what support is on offer in your local area. It could be a specialist stop smoking service, guidance from trained professionals within maternity services or other stop smoking providers in the community. Typically, the woman will be offered a 12-week program of behavioural support. At her first appointment with a stop smoking advisor, she will be asked to discuss her smoking history and agree on a plan to help her quit. Often, support will involve nicotine replacement therapy such as patches or gum. She could also choose to use an e-cigarette if it will help her to stop smoking. E-cigarettes don't burn tobacco and don't contain tar or carbon monoxide. They aren't completely risk-free, but they carry a small fraction of the risk of cigarettes. While it is the nicotine that is addictive, it is the other chemicals in tobacco smoke that cause most of the harm. Face-to-face support and access to nicotine has been proven to give pregnant smokers the best chance of success. It is important you motivate pregnant smokers to use this support and to continue to monitor their progress throughout their pregnancy and after the baby is born.